Tonight, I'm going to share with you the wellness tool that has had one of the greatest impacts on my health and so many that I have shared it with. First, I want to share a really amazing health journey with you.
I started using the patch in April of 2020, so about 9 months now. I had a pretty significant knee injury in 1999 that's known in the medical field as the unholy triad. So that's your anterior cruciate, your medial collateral ligament, as well as your medial meniscus. And I tore all of them. I had my first knee reconstructive surgery in 2000 and have since had 6 additional reconstructions on top of that. So I've had 7 knee reconstructions between 2000 and 2015. The original surgery was a patellar tendon graft. So they took the center third of my patellar tendon. When they drilled the tunnel to put the new ACL in, they drilled it at the wrong angle. So I was literally severing my ACL with any movement within the hinge joint. They also tried to save as much cartilage as they could with cartilage clips, where they clip it into place and then hope that it works. Because cartilage is so avascular, there's no blood flow for healing. It didn't work. And so not only was I severing the ACL, I was also having large pieces of cartilage pop in and out of my knee, or literally sometimes I'd have to push them back into place. It's been quite a journey with all of the surgeries. So I was a candidate, after my last surgery in 2015, a candidate for a total knee replacement. I talked to multiple surgeons and no surgeons were willing to do the surgery because of my age. So they say that a total knee replacement should last for 15 to 20 years, but that's based on studies conducted of the average age being 55 when they're put in. So I was told by each surgeon that I spoke to that they anticipated by the time I was in my mid-50s, I would be on my second or third knee because I would wear it out. Because of my age, I would wear it out, and it would wear out much quicker. The second's not as good as the first, and the third's not as good as the second. And so their concern was I would be on my third in quality of life and everything else. So for the last 20 years, I've really been living with significant knee pain and inflammation. Significant inflammation, where my knee would always be about twice the size of my other knee. So in April of 2020.
Wait, Jared, I wanted to ask you, I know that you tried, they were giving you different things like injections and some kind of graft. Can you talk a little bit about what happened there?
The graft was the most recent surgery, but the injections were a viscous solution. I don't remember the different byproducts used to create, a more viscous, lubricated, if you will. They tried thermally tightening ligaments. None of it worked, and it just led to more pain and issues. So in April of this year, I stopped by Marie Euler's house, who sponsored me. And anyone that's on the call that knows Marie, when she's really excited, she talks really fast and with her hands. And so I knew whatever she was talking about was significant. She was telling me that she had just bought these patches, and she had me in mind with my knee, and they were going to help. And what I really heard was stem cell. And so I was like, okay, what do I have to lose? I have everything to gain. So I was getting ready to go on a camping trip with my dad and my 2 sons. And on the 3rd day of wearing the patch, we were on quads, and I didn't realize that I had an audience, but I jumped off my quad anticipating the pain that I was so accustomed to, and when I landed, I didn't have any pain. And I remember I probably looked like Chubby Checker doing the twist in the middle of the Eastern Oregon desert, not knowing I had an audience. And then I could hear my dad snickering in the background, like, what are you doing? And I was like, Dad, my knee, it doesn't hurt. I don't have any pain. And this was after the 3rd day. So it was really, really significant to know that quickly my knee wasn't bothering me. And so since then to now, my knee feels the best that it has in 20 years. I also suffer from a condition known as idiopathic intracranial hypertension, or pseudotumor, which is basically an elevated spinal fluid level. So your body reacts to it as if it's a brain tumor. It leads to significant migraine headaches. So for the last 10 years, from the time of my diagnosis, every 6 months I would have a spinal tap to remove excess spinal fluid in order to help me with the headaches. Since I've been on the patch, my headaches are extremely minimal, to say the least. I lived with a chronic, on a scale of 1 to 10, I would say a chronic 4 or 5 in pain level. And now it's 1, usually maybe a 2 at most. So it's absolutely been incredible what it's done. My last spinal tap was in May of last year. It was the lowest opening pressure that I've had in the last 10 years, with the least amount of spinal fluid removed. So I know that what it's doing is incredible. I've introduced it to my dad, who's got degenerative disc disease. It was to the point with him, and I'll just share this story. He would do a load of laundry, take it out of the dryer, carry it to the couch, and have to get on his hands and knees to fold laundry because the pain was so significant. And within the last probably 4 months, he out and he was really excited, and I was like, what is going on? He's like, I just did laundry, and I was 3/4 of the way through folding it, and I realized I was bending over. I hadn't gone to my hands and knees. I've given it to my stepdad, who also has significant back problems, and he's noted improvement. I've given it to both of my sons. My oldest is 22, my youngest is 12. With my 12-year-old, he's on the spectrum. It's helped with mood stabilization. He also wears the sleep patch. It's truly been miraculous. So, I'm sold, and I can't believe what it's done. So thanks again for inviting me to share.